All right, time for an update.
Indeed. Yeah, I'll go here. It's been about 10 and a half weeks since treatment finished up on Christmas Eve. And we are moving along. Things are progressing. We haven't had a lot to tell because little things have happened over this period of time.
Little things that were big. I mean, they were big things, but yeah, I mean, they sent us home on Christmas Eve and said, heal and wait. Your job is to heal and gain strength and gain weight and learn to eat again and wait 3 months so that we could see if treatment worked.
Just wait 3 months. No biggie. We'll see you then.
Have a nice Christmas.
Really? So yeah, so we've done that, and along the way, good things have happened. My taste buds came back about 3 weeks. 3 weeks, and yeah, and that was a process. So they started coming back, and it was about 10 days of coming back where some things tasted okay and other things didn't taste okay. Yep. But we got rid of the rancid, which was very nice. Yep. Which meant that after that, about 3 weeks later, we could get rid of the tube. So I'm here, there's no PICC line, there's no tube. I'm just a regular guy with a little less facial hair.
I'm a real boy.
So,
I got no strings to tie me down.
So here we are, and we're waiting. We've got about 10 days until PET scan. We'll talk a little bit about that now based on what we got from the surgeon yesterday.
So as you've kind of, your trajectory of healing has really been you healed fast and it was great and it was wonderful. About 3 weeks ago, you started to get more tightness in your jaw, and that's been always, that's scar tissue. It's trismus is what it's called, and being able to open your jaw wide enough and those kinds of things. And then you progressively started to get a sore throat. It became more difficult to swallow. Food was more painful. You were having to get it smaller than you had been.
Absolutely.
And so that definitely felt like it was going in the wrong direction. So we went and saw the surgeon yesterday, and the surgeon looked in your mouth and said you have oropharyngeal ulcer, basically just like any ulcer that you would get, but in the back of your throat. And that is typical, par for the course for this point in treatment. Kind of a surprise to us because you were healing, and so you don't expect to take a step back, but it does feel like a step back. It does look like a step back. Doctor says it looks better than the last time he saw it, and he saw it
8 weeks ago,
8 weeks ago. Yeah. So there is still healing, but it is becoming more, I guess, intrusive or difficult. Yeah. And so he said that, we would kind of proceed to the PET scan and we would see what would happen. What we've learned from the data, it's not very data driven of you, what we've learned from the data is that 80% of people who've had your treatment with your cancer will have an oropharyngeal ulcer. That's, as the doctor said, pretty par for the course. Of those people, about 30% of them, it represents disease progression. So for 70% it doesn't. For 70% it's just a normal part of healing, but for 30% it does represent the presence of cancer.
Right.
So the surgeon said, they may want to biopsy it. You may be back here for a biopsy pretty soon. And we kind of talked through that process of what that's going to look like. What we know now is that it's, when they do PET scans look for two things. They light up. They light up in two ways. You can do that again? Yeah. Light up. They light up when there's abnormal metabolic stuff in the cell. If the cell is eating faster than it should, it's an abnormal cell. That indicates cancer. PET scans also light up for inflammation. So we know for sure that your throat is inflamed. We can see it. The doctor can see it. He confirmed it. And so unless there's something miraculous that happens in the next 10 days, we are very unlikely to have a normal PET scan, we're going to see that spot light up.
Yeah, and we also know at this point that that's not necessarily a bad thing.
Right.
It's just an inconclusive thing or the next step.
Right.
Because what we'll do at that point is have it biopsied.
Insist on a biopsy.
We'll just have it biopsied and checked out, and that'll be that. And it shouldn't be too intrusive, and it shouldn't be too big of a deal.
Yeah.
And then we'll have a little bit more information at that particular time.
Yep. No, that's what we're looking for. That's what we're aiming towards. You know, I think I have some nervousness that the doctor will say, let's wait and see. Doctors tend to be wait and see kind of people, and I have no interest in that.
Right.
It's not very data driven.
It's not, and it's also was also part of the challenge that we had getting started on this whole journey.
Yeah.
So.
Yeah. So we will most likely be looking at a biopsy here pretty soon. If not just a little bit after that PET scan. Again, the data says that of the people who have these oropharyngeal ulcers, most people see that clear up at 3.5 months. So we'll be at 3 months when we have the PET scan. Mm-hmm. If for some reason they say, let's wait 2 more weeks and see if it clears up, then we probably will do that. But pretty close after that, we'll be looking at a biopsy to see for sure what's in there.
So overall, progress continues. It's good.
Yeah.
And we're doing more and more normal things.
Yeah.
With a little different perspective.
Yeah.
And we'll see where things go from here.
Yep.
It's always an adventure.
Always.